I distinctly remember there were some days I don't remember what really I learned in the OR or what happened in the OR because, you go through the motions and your body is kind of on autopilot, but without sleep, it's really, really difficult.
Welcome to Fem MD, real talk for women who are balancing careers, ambition, and the chaos that comes with it all. Today's guest is Dr. Maheetha. She's our dancing urologic physician. We connected years ago. She's a brilliant woman. She was inspired by her own mother to go into medicine. She's one of very few female physicians who chose the road of urologic surgery. She's also really authentically herself online, which is what drew me to her initially. And I'm excited to talk to her about being herself, kind of breaking the narratives and not shrinking to fit in with the norm. Let's dive in. Good morning. How are you?
I'm really good. Thank you so much for having me on here. I'm great.
Yeah. Okay. So the last time we saw each other was at the Hippocratic Collective Philly event. It was so much fun to kind of
Yes.
see you in person. I know we connected years ago on social media.
Yeah.
Before we jump in, I have to tell you something super funny. So my
Okay.
7-year-old, who is quite bright little child,
Okay.
the other morning we were sitting on the couch and I was like, buddy, your femur is so long. Like, you're getting so big.
Mhm.
And so we were going through and I was teaching him different like anatomical parts of the body.
Uh-huh.
And he was like, "How do you know all that stuff?" And I was like, "Well, buddy, you go to medical school and then, because he's like, I thought you
Mhm.
only worked on the face."
Mhm.
And so I was like, "Well, you go to med school, you get to pick what you want to work on." And he was like, "So are there like private doctors, like doctors that work on your privates?" And I was like, "Yes." And he was like, "Who on earth would want to be a privates doctor?"
I'm dead.
So let us start the show by you telling us first what drew you to medicine. And
Yeah.
then what led you to urology?
Okay. I think those are very great questions. I love answering those questions. So, what drew me to medicine? So, my mom is a doctor, and she was the first doctor in her family in India. And when she came to the United States, I used to essentially hear her up at night, like 2 a.m., 3 a.m., basically helping her family members in India. And I thought that was a really noble thing. I distinctly remember these moments. I wasn't strongly considering medicine until in high school. I took AP biology and I really, really loved like the science and the genetics, especially the genetics part where I could see how like changes in your DNA, like just one little thing could cause your phenotype and the disease that you presented to look very, very different. And so
Mhm,
that was very interesting to me. So I thought I was actually going to do like a PhD or just something in science, like research.
mhm.
But what actually drew me to medicine was the arts. And that is because when I was in high school, I started playing the piano at nursing homes. And a patient at this nursing home that did not remember her name, did not remember who she was, knew all the words to Edelweiss, the song from The Sound of Music. And so I was like, this is such a beautiful thing that, like, not necessarily science can explain fully, but it brings out a
Yeah,
very human side of medicine, right? Where I was like, huh, I really love the science behind, what brings like genetics to phenotype, but I also love understanding like what makes us all unique that may not necessarily be able to be explained by just your DNA. And so it was kind of like this nature versus nurture that I was really getting involved in. And that's when I was like, I think the best place to kind of study that in a way that combines my passions and is able to give back to the community is through medicine. So that's kind of what I did all through undergrad is I did research, but I also found ways to combine science and medicine where I was like, or science and arts, excuse me, where it was like, I was trying to develop dance lesson plans for high school students that would teach them science, but through dance. I was continuing to play music at nursing homes and cancer centers. So that eventually kind of just solidified this desire to go into medicine where I felt like I could do both. I could do both arts and I could do science. Um, when it came to urology, it was kind of like a similar thing, except now it was surgery and medicine. So I
Yeah.
really liked medicine. I also really liked surgery, and urology was a space that kind of had a lot of both, kind of like ENT, actually. I
Yeah.
was actually in between ENT and urology for a very, very long time. I really, really liked talking to patients about very vulnerable, taboo topics. I also liked the humor that a lot of urologists found themselves in. Being
Mhm.
in urology. So I think it was more of like I knew I kind of wanted to do both surgery and medicine, and then it was like a feel.
Yeah, that's okay. So that's a beautiful start to your career in medicine. I mean, having your mom as a role model, also the maturity that you had to play piano at a nursing home, like that. And you just told us that your first name means goddess of the earth. Like you just have this like aura of energy about you that's very sweet. And I can tell that you're going to do so much good in the world.
Oh,
Probably already
thank you.
have.
That means a lot coming from you.
For those that are unfamiliar with urologic surgery, give us
Yeah.
kind of a brief overview of kind of what the bread and butter is, what kind of your day-to-day looks like, and then we're gonna jump into kind of the residency aspect.
Yes. Okay. So, um, urology is the ability to do surgery on, I would say, most organs that touch urine. I think that's a easy way for people to kind of get started on like, okay, so what organs touch urine? So it's the kidney, the ureter, which is the tubes that connect the kidney to the bladder, and the urethra. So those are the four main sort of urologic organs. In men, the urethra is also um, a sexual organ in a way that it expels semen. And so taking care of the penis and the testicles is also what urologists do, particularly in men. And so but women also have kidneys and bladders and urethras and ureters. So people often
Thank God,
associate
right?
urology just with male reproductive organs, which also includes the prostate, by the way. But we forget that, women also have bladders and kidneys, and we operate on bladders and kidneys. We take out bladder cancers in women. We take out kidney cancers in women. We take out stones in women that are in their kidney or the ureter or the bladder. So our patient population consists of both men and women. Um, and I also want to point out that there is a huge space within urology for gender affirming care as well, right? So we do the vaginoplasties for gender affirming care for trans women, and we do metoidoplasties for as gender affirming care for trans men. We also take care of a lot of, gender non-binary patients as well. We take care of intersex patients. So that's also one of the great things I love about urology is that it gives us the opportunity to really understand the spectrum of what gender and sexuality, as well as what reproductive organs look like
Mhm.
in our population, and to also be able to challenge these preconceived notions about what gender and sex should really, really look like, and be able to advocate for our patients in that space. And so that's one of the things I really, really love about urology as well.
With a sensitive topic like gender affirming care, I mean, is it
Yeah,
hard to bring down the barriers in a sense? Like you meet the patient for the very first time, you're one stranger looking at another stranger and talking about this
absolutely.
like deeply intimate topic. What are some, I mean, I get the sense that your personality is quite good at that, but if someone maybe is struggling with connecting with
Absolutely.
patients on a more intimate or personal level, probably not intimate is the right word,
Yeah.
but what are some tactics you use or have seen some of your attendings use to help make that connection early on with patients?
Absolutely. I think a big thing that doctors can do is really pay attention to their own body language and how they are positioning themselves with patients. I actually did my capstone project in medical school on this. where I created a Indian classical dance narrative on a patient going through a cancer diagnosis. And one thing that I and my medical school partner, while we were creating this, we realized is like the importance of nonverbal communication and body positioning and how that comes across to a patient and can actually put a patient at ease. So oftentimes what I do is I always make sure that my body is positioned like lower than the patient
Mhm.
in the room, that I am making eye contact, but I'm positioning myself that like the door is right there so that I'm not blocking. I'm not seen as like obstructing a patient's sort of ability to leave the situation if they wanted to.
Mm.
And just, I think we all perfect this through our training, but um, asking questions that are open ended that allow the patient to kind of talk about whatever they want, and then using that to then ask deeper questions. Because I really just want to make sure and make the patient feel like they are in control of this situation from top to bottom, right? I am here to help them. I'm here to just offer guidance, offer assistance in whatever way they need. And so it's kind of my way of saying, help me help you, right? Guide me to help you. And so those are some of the things that I do.
Yeah, and even though we work at I'm on the North Pole, you're on the South Pole of a human, um, I like cosmetic surgery
Hmm.
and, very elective type procedures because I tell people the exact same thing. Like, I'm a resource. Today is just
Yeah,
you getting to know me getting to know
absolutely.
you. We can talk about an array of options. At the end of the day, it is totally up to you. And if you end up not having anything done with me or going to a different doctor, that's totally fine.
Yeah.
Um, okay, so the further I get out of residency, the
Uh
more
huh.
of like positive memories I have about it because I think I
Yeah.
kind of forget all the hours and the sleep deprivation. Tell us kind of how residency has been, some of the ups and downs and kind of how far you are in and how long you have left.
Okay. So, urology is either a 5 year or a 6 year residency, depending on the program that you go to. It is always a 5 year clinical residency, but the 6 year program will have a year of research. So, I am currently in my research year. This year is usually between the third clinical year and the fourth clinical year. So, I'm a fourth year urology resident, but I've only completed 3 clinical years and I'm in my research year. And I will go back for 2 more years to complete my entire residency. So 6 years. Um, and I I have actually loved residency. And I know that's not something that you hear often, but I do think it's important to say that I think residency has been rewarding in a lot of ways, particularly because with every day I see myself grow into the kind of urologist that I want to become. I see myself grow in skills. I see myself accomplish things that I wasn't able to do the day prior or the year prior. Right now, thinking about where I was as a second year, not even being able to put a cystoscope into a urethra. Now I'm able to assist naturally on, bigger cases. And so seeing that growth, which I'm sure you also experienced, is seeing that growth is really, really rewarding, right? But
Yeah, for sure. And for those that kind of are unfamiliar with surgical training, oftentimes the residencies for anything surgical are longer because not only are you accruing all the information that surrounds, bladder histology and pathology, like all of the medical stuff that can go wrong and right and different anatomy, but then you're also developing like the physical dexterity of operating with your hands in these tight spaces, utilizing a huge array of instruments, and then like the whole human component about like
absolutely.
learning how to connect with patients and make, the right decision for them.
Yeah, my attendings always say it's a 5 year residency for a reason. Whenever I'm not able to do something or I was like, I thought, and progress also doesn't look like this, right? It doesn't look like a straight line. It looks
Yeah.
like this, and ultimately it gets there. But on these downs, you get really dejected because you're like, gosh, I was able to do this just 2 weeks ago, but not every patient is the same. Not every patient body habitus is the same. Not every abdomen looks the same with the anatomy. And so, it it takes 5 years to accrue the diversity of what you can see and then be able to be comfortable taking care of a wider range of pathologies. Um,
You said that you see yourself becoming the urologist that you wanna be.
yeah,
Let's look forward at future
yeah.
Maheetha. What type of urologist is she?
I value education. And I think the kind of urologist that I want to become is somebody that educates the world on urology and how that affects our day-to-day lives and how we can help patients with urologic conditions. I think that's my ultimate goal, and I do that on social media already. And how I educate is something that there's so many possibilities, right? Am I going to be in an academic institution educating residents and growing the next generation? I'd like to do that actually. I like the idea of becoming a program director who's, you know, very supportive to all the residents, and all the residents look up to the program director. The program director is their like mom in residency, right? Like
Mhm.
residency mom. Is that who I'm going to be? I think I would be good at that. I think my program directors say you would be good at that. Um, or do I see myself being more of a urologist in media, right? Whether it's social media online, or is it writing scripts for shows like St. Denis Medical and The Pit, where through that we can educate the world on what urologists do or what common urologic conditions. I mean, I know that The Pit, which has already started, season 2 started, released yesterday. Um, the Pit has definitely sensationalized medicine, and I have heard from my urology colleagues who are more in the political side that shows like The Pit have made representatives, senators, government officials more sympathetic towards folks in medicine, because of
Mhm.
their portrayal of what it means to be a doctor in 2024, 2025. And so, is that the avenue I'm going to take? The possibilities are endless, but I feel like I just need to make a decision. Maybe I could do both, but maybe not. Maybe I decide that I just wanna do one over the other. So, who knows?
I love it. I do think the show, The Pit, if anyone hasn't watched it, it's very good. It shows a lot of, like, the grind and the
Absolutely.
challenges that come with working in healthcare.
Yeah.
What are some of the grind aspects that
Oh,
you experienced during residency?
absolutely. I think one of the difficult parts of any surgical residency is call. I think residency as a whole would be much easier if call was not a thing. But you've been through call. I've I've been through call. It is brutal. The requirement to essentially not sleep well
Yeah.
for multiple nights in a row sometimes. And that is one of probably the most grueling parts of my residency. Now, call can look different. And what I mean by call is essentially somebody needs to be awake and able to take care of patients overnight, right? So some resident is doing that every single
Mhm.
night. It's a different resident every night. But sometimes the gap in between when you are required to be on call can be very small. And that's what makes residency very difficult. Is not only are you trying to learn all of these things because the information is coming to you through a water hose, but on top of that, you're trying to learn all these things on minimal sleep. And that is the thing that to me makes residency very, very difficult.
Yeah. At our program, we took home call, which was interesting. It was nice to be at home,
Mhm.
but it was kind of a slippery slope because a lot of those
Absolutely.
hours didn't count towards
Absolutely.
if anyone's not familiar with how kind of residents are restricted, there's a big overseeing body called the ACGME, and they say that a resident should not work more than an average of 80 hours per week over
Mhm.
a 4-week period. And then there's kind of like some sub rules beneath that, like you shouldn't work over like a certain stretch of time, kind of like airline pilots, like they're restricted on hours. But with home call, we would often, yeah, potentially not sleep at all. Like
Absolutely.
you work all Monday, you're on call all Monday night, you work all day Tuesday, And I found that it was very like resident to resident. Some people can do pretty well without sleep, and then some people really suffer cognitively.
Absolutely. Like, I distinctly remember there were some days I don't remember what really I learned in the OR or what happened in the OR because, you go through the motions and your body is kind of on autopilot, but without sleep, it's really, really difficult. It's really, really difficult.
Yeah.
And
You're
we do
kind of
home
in
call.
you're kind of in survival mode in a sense.
Absolutely. And, one thing I love about my program is that attendings like understand that and your co-residents kind of understand that. And so they really will try their best to get you home, earlier on your post call day, which is not really a post call day when you have home call. So in urology, it's almost exclusively home call as well,
Mhm.
where you can take call from home, but you are getting called every hour. So that is yeah, that's one of the difficult things about urology as a residency.
Also, I felt like the thing with being a surgical subspecialist is typically when they called you and you had to go see someone, it wasn't just like pop in, say hi. It was like you
Absolutely.
were doing a procedure. So
Absolutely.
minimum, like getting your butt out of bed, getting your scrubs on, going to the hospital, parking, going in. Da, da,
Yeah.
da, da. It's like
Mm,
at least 2 hours before you're back in your
absolutely.
bed.
Yeah. Yeah. Every call takes at least 2 hours of I'm up and out of bedtime. And I don't know if you experience this, Dr. Umstead, but I have trouble going back to sleep because I've now looked at my screen, right? I've
Hmm.
looked at my screen, I've looked at the laptop. Now that blue light has infiltrated my brain, and I am now not able to go back to sleep. So it takes me half an hour, 45 minutes to just like close my eyes and go back to sleep. And then within that time, I get another page. So
Hmm.
that is how a lot of weekends have been.
I would give myself little treatsies on the way home. And it was either if I was at one hospital, it would be White Castle. If it was another hospital, I would go by Taco Bell.
Oh my God. Oh my God. That I need to think about doing that more often.
I can't say I would recommend that, but that's what I did to make it through the night. Okay, I want to switch gears
Hmm.
a little bit and talk about the gender differences from a
Mm,
provider standpoint in urology.
yes.
From an outsider's perspective, it very much seems like a boys' club.
Hmm.
You obviously are not a boy. So
Hmm.
talk about like, did that deter you at all from choosing urology? Do you feel like it makes you a better provider because you're a little bit different than everybody?
I think that I truly fell in love with urology due to what they do for patients. I did have the gender ratio in my mind, and it actually did deter me from applying to certain programs during the application cycle. It deterred me from ranking certain programs during the application cycle
Hmm.
because during the interviews, I kind of saw what the dynamic was. I saw what the ratio, I look on our website, I saw what the ratio was. It's really hard being the first woman resident to be in a program, right? That's
Hmm.
really hard. And, you know, hats off to the people who are in that position because new urology programs are developed, every few years and they always start with one resident and one resident per class. And so at some point somebody has to be, the first female resident in a residency that is likely, founded by mostly male faculty.
Hmm.
And so I am very fortunate that I'm currently at a program where our faculty is as balanced as it can get. But even within that, there are certain differences. For example, I am interested in urologic oncology. And while in general urology, there is more of a balance between female and male physicians, as well as queer, um, non binary patients, physicians as well in urologic oncology, there's definitely fewer women. And so even when in the subspecialties, you see that there are still differences and gaps in where there are not as many female physicians. So that while in residency right now, I've had the wonderful opportunity to have many female physician mentors. I am a little nervous going into the SUO, Society for Urologic Oncology fellowship cycle, because I'm like, okay, well, now I'm coming into a slightly even more male dominated space than I was previously in. At the time I was applying, the stats were that there were only 10% of urology physicians that were practicing that were women. And the residencies had 30% women. And so it is changing. There are great efforts to recruit more women into urology. The Society for Women in Urology is a wonderful example of that. There's also a Society for Women in Urologic Oncology as well that has grown tremendously in the past 10 years. But if you look at when I went to AUA, the national meeting, versus SUO, the Society for Urologic Oncology meeting, I could see the
A
distribution
big
of
difference. Yeah.
big difference between how many women were at AUA versus how many women I saw at SUO. And so that is something that I do think about and is something that needs to be talked about.
Yeah. Well, feeding the pipeline. I love it. You're making the change. Okay, so we first connected on TikTok years ago.
Yes, I want to talk
Ever
about that.
ever since I found you on TikTok, I really admired your level of authenticity. For anyone listening, you need
Thank
to
you.
pause the show right now, go on TikTok, and okay, so let's talk about your journey to first opening the app, posting some
Mm,
of your content. I'll let you kind of open the door and let listeners in on some of the fun stuff that you like to do.
absolutely. So, Dr. Umstead, I've always been kind of a
Okay,
content.
also, it's Lauren. Lauren is best, yes.
I like can't. The immigrant in me cannot. Oh my god. Okay, Lauren, I have always been a content creator in the sense that I've always been dancing. And when you dance, you like choreograph, you block people together. I teach dance workshops. So when people are like, "Oh, when did you start becoming a content creator?" I honestly say like, "Yeah, when I was 5, when I started dancing because through that you do a lot of content, which is performance creation." And so that kind of like creating content was not necessarily a new part for me, but trying to use that to connect to an audience was the new part for me. And I'd already somewhat done this for my capstone in medical school. So I started TikTok as a fourth year medical student after residency applications, wink wink. But
Okay,
in my
pause there for a
Mhm.
second, because I would imagine there are a lot of medical students who are interested in putting content
Correct.
out there but are nervous. So why did you wait until after?
Well, because social media wasn't really that big of a thing back in 2021, right? So
Okay.
people were still very, very nervous about that. My advice for medical students would be very different now because I think it's becoming more and more and more accepted. I do see that.
Mm-hmm.
I
Mm-hmm.
also think that surgical programs, particularly surgical residencies that are very male dominated, are oftentimes less. I feel like overall culturally less open to new technologies than, for example, a medical field or a surgical field that is heavily female dominated. We know that because I knew so many OBGYN medical students and residents who were talking about like women's health online. And that is something that I think the OBGYN field really, really loves and appreciates. And I've brought this to my program director and chairs before. It's like, look at all these other specialties that like this is how they're like supporting their residents and medical students. And that also having that open communication, which is another thing I say, like have open communication with like your med school chair, with your program director, with your chair, with your program chair about what you want to do on social media. Because once I opened that communication with them, they were way more invested and they were way more supportive because they're like, okay, we trust that this medical student, this resident is not going to sabotage, you know, try to ruin or tarnish our reputation or their reputation, and they are allowing for us to also give them feedback on what we feel like they can post and maybe should stay away from posting.
When you
So
had those conversations, were there ever moments where your program directors, et cetera, administrators were like, you can't do this, you shouldn't do that? Like, did they
I
put
don't
restrictions on you?
I don't think, well, that there's a little bit of reading in between the lines there. So I don't think that they would ever say you cannot do this. But I think that there are guidelines and recommendations where they are like, I would suggest you stay away or like you not do this, which is like essentially their way of saying don't do this. But I also was able to kind of negotiate a little bit, because um, I do think, for example, one area where everybody is always a little sensitive to is like political content, right? Political
Oh, for
content that
sure.
says like anything about, and my first day of residency, Roe v. Wade was overturned. My first day in the hospital, right? That was the news. And so, you know, and I posted a few TikToks about that, for which my program was like, I feel like, maybe this is very controversial territory. I would be careful, is what they say, right? So then it takes some time and negotiation to be like, okay, maybe 80% of my content is authentic dancing urology, and then maybe a small 20% of it is, talking about issues that I really, really care about that are maybe related to healthcare. And so now, instead of just thinking about a political angle, I have told my, programs like, how about maybe we can be pro health and pro science and talk about it from that angle, right? And it
Hmm.
took some time to get there and negotiate that, but I think it's worth it because I want to talk about gender affirming care. I want to talk about SNAP benefits and how that's awful, and how these things affect my patients, how as a doctor these things affect my patients. And so now they're definitely more receptive to that.
It's so refreshing to hear that your program has really been interested and amenable to working with you through it all. I
Yes.
can imagine that not every
Not every yes,
resident student department out there.
absolutely.
I think
I
of these academic departments as, especially in the world of surgical subspecialties, as being run by these like old dusty dinosaurs
Mhm.
that don't even like know what the different social platforms are. So,
Absolutely.
when you interviewed for your program before
Mhm.
you were a resident there, did you get a sense that they were open to kind of
Yeah,
the less than like normal applicant, I would say?
absolutely. There were many I made note of the programs that asked me specifically about my social media and what I wanted to do with it. So, um, just a shout out to some programs that did that. Stanford did that. Stanford Urology definitely asked me about my social media. They were, you know, they had multiple brownie points because of that. My program did that, multiple brownie points because of that. NYU did that, multiple brownie points for that. So there, I made note of the programs that definitely asked me specifically about my social media and were positive about it,
Yeah.
too. I think that was also important. I think there were some programs that were like, what do you think about social media in this current climate? And I was, had my cooked up answers for that, prepared. But there were a lot of programs that were like, wow, this could be used for the future, especially some of the more like techie programs were like, oh, this could be used for good in the future. And so I think that was definitely very evident because I had already had a social media profile by the time I was applying for residency a little bit.
Hmm. Yeah, I think it's important to be really open and honest during your
Absolutely.
residency interviews because you want to match at a program where they like you for you because
Bingo.
the truth is going to come out after years of being there and they really see you at your worst, like your
Hmm.
true stripped self because with sleep deprivation and hunger and you can't pee. I mean, they like really strip you to the core. And so I think it's good advice to give med students to be really as much as you can be yourself on the interviews, which is hard also
Yeah,
because you're kind of nervous and you definitely want to match somewhere.
absolutely. Absolutely. It's such a balance, And I think I also know that it's very easy from being on the other side to be like, "Oh, you should just, be yourself and like you will match to a program that wants you." But, that's not necessarily how I felt when I was on the med student side, right? So it's I do think it's important to be authentic because you do not want you will do worse at a place that like doesn't like you.
Hmm.
Um, and so it's finding that balance is can be very tricky.
So we've talked about your educational content, your
Mhm.
dance content. We need to talk about the Kardashian skits.
Yeah, what do you wanna know?
I don't know. Give us some voices here. You do such a good job with like Courtney, Kim, Chloe.
I didn't
Have you always been a big Kardashian fan?
I I have found their episodes funny. I would not say that I've like ardently watched Keeping Up with the Kardashians every day, but I do find a lot of their content funny. I also find because my inspiration, while it came predominantly from Keeping Up with the Kardashians, it also came a lot from people who had already been doing parodies of Keeping Up with the Kardashians, like, on their own about
Hmm.
different things. So there's a famous content creator called Bowmanizer who essentially does all of his skits like it's like creating a new makeup company, but make it the Kardashians, right? Going to the store, but make it the Kardashians. And it is absolutely what he does is absolutely brilliant. And so it's people like I saw the engagement that that had, and I was like, I think like this is a great way to engage the medical community about doctoring things, right? So, and it also went back to my desire to do like script writing and like creating skits, right? Because when you choreograph dance pieces, you're also choreographing narratives and stories through these dance pieces. And so this was just like another way of creating narratives and skits through a more humorous way. And so
Hmm.
I was like, well, we essentially have shows like TV shows like The Pit, Grey's Anatomy that try to sensationalize what is happening in the hospital. Why not do that in a reality TV format, right? This is exactly what would happen if the Kardashians were doctors, right? And I really do try to make them educational too, right?
Yeah.
Like my most recent one with my mom had the PPS score, the palliative performance score. I didn't know what that was, but now people know what a palliative performance score is, which because they'll look at it, they'll look it up, they'll be like, oh, like this is how palliative care doctors like decide what kind of goals of care discussion to have with their patients. And so I really do try to make I remember my first collaborative one with Preston Roche. He is a content creator, a psych resident, and he has a podcast called How to Be Patient. And my first one with him was a back and forth between psych and urology about retention, essentially. And so I distinctly remember I said, I want to have a line about how antipsychotic medications can cause retention. That is something that's a recommendation that we as
Urinary,
urologists give.
oh, for
Oh, yes.
listeners, urinary retention, where basically you can't pee. It's like stuck in your bladder.
Thank you. Urinary retention. Um, and so I really try to incorporate education even in those humorous skits. Even in my dancing skits, I do a lot of dancing skits on different surgical techniques and surgical procedures in urology. So I'm thinking about education really almost in everything that I do and I post, which is my passion.
Yeah, I mean, your ability to weave like humor and art into these like very, some would argue, boring topics definitely make them more interesting to consume for sure. And I think it's a fun way for the layperson, even other providers. Like I've learned stuff from your videos. I'm like, oh, I didn't know that. It gives you a way to remember it as well.
Absolutely. That's one thing that I also have been telling my program directors too is that when I teach, when I educate, that forces me to really hunker down and know the details to the T about what I'm talking about. And my videos also go through like several reviews, even with the urology oncologists in my department or the andrologists in my department. When I'm talking about something, I want to make sure that I am accurate and that I am also addressing the nuances, which is hard to do in a less than 3-minute video. But I think that it's really important that I do that because I want to make sure that I'm, not contributing to the disinformation or misinformation problem on social media.
Have you found it's hard to find time to do social media in addition to all the responsibilities of being a resident?
I do think it's definitely been much, much easier during my research year this year, which is where I've seen the most growth in my social media platforms because I am posting more often. But last year, it was hard. It was hard. So I batch create content on a Sunday. So
Hmm.
I am sacrificing that time because I treat this kind of like a part-time job where I set aside a few hours every Saturday or Sunday to batch create content. I'm thinking about ideas throughout the week. I create scripts on it's like a continuous ruminating basis. I don't wanna say ruminating because that's like a negative connotation, but I mull around in my brain to, like, think about scripts and what I'm gonna write, and then suddenly it will just one day, like, come, right? It
Hmm.
will just one day write itself, and that process I find very joyful, but it does take time, and I'm not able to do that every week or every other day, post something during my clinical years, my R2 year and R3 year. If you see sort of the time in between my posts, it was a lot. It was, sometimes I would go days, multiple days at a time without posting, weeks at a time without posting. So, yeah.
Residents don't make a ton of money. You can tell just organically you love putting content out there, but
hmm
there is the potential monetary benefit. I mean, have you made some money posting videos like through the platforms?
I think so. TikTok has a content creator program, but the problem with TikTok for me right now is that they really require you to either capitalize on TikTok shop or post every single day. And for me, and I'm sure you experience this too, if you don't post for a few days on TikTok, then your next video automatically has like 2 views. When it's
Mhm.
like, "What? Like you have so many followers. Like what how is that possible?" Because the purpose of TikTok is for virality, right? So they're only going to show you viral videos. You could follow a person and then never know who they are ever again because they never show up on your For You page ever again because the For You page is filled with like purely viral videos. And so I feel like that model for me really doesn't work because I don't have that kind of time. I don't have that kind of time to post multiple times a day, multiple days a week. And so it's not that I've given up on TikTok. I just think my attention has shifted to Instagram, where I think a lot of people have gotten a lot of growth,
Mhm.
particularly because Instagram is first a community before it is a Reels business.
Yeah.
And that's because I had 1,400 people on Instagram that were my friends that I was connected with before even I started Reels. And Instagram has more reach. And also, I feel like I could go days without posting on Instagram and a good video will go viral, right? A
Mhm.
good quality content video will go viral on Instagram. But that's not the same on TikTok, right? If I don't post for days, a good quality video on TikTok will not go viral. And that's just really unfortunate. It's just how the algorithms are different. So I have lost a lot of the monetization on TikTok because of that. I used to, monetize at least, 12 or $15 per video, but now I barely get anything. I also do want to say that most of the monetary value from social media, and you'll see other content creators talk about this too, is that it really comes from like the brand deals and, the other kinds of monetary influx that you get that are not necessarily directly from views. I like collaborating with companies that are directly related to my line of work and help me with my line of work. For example, I am a Figs ambassador, and I really work a lot with Clove, the shoe company. The Hippocratic Collective loves Clove. We're all, one big family. But I know that my purpose on social media is not necessarily to make money. That's not why I'm on this
Yeah.
platform. And so I don't really worry too much about the monetary aspects of it. Um, I think, for people who are hustling and making this their side hustle, great. That is not my priority at this time, and I don't think it will be even in the near future.
Yeah, same. I just see other like medical content creators that have made posts about them like paying off their entire
Yeah.
med school loan, and it's impressive how you can harness these different platforms that are
Yeah.
constantly evolving and they're free and you
Yeah.
can kind of use them as you wish, which is really an
Totally.
incredible opportunity.
And that's amazing too. And I've noticed this with brand deals as well is that, I really, really try to ensure that the brands that I'm working with are authentic. I love Clove for that reason, but not every company is like Clove. So sometimes you have to be a little careful because I don't want my name to be attached to necessarily a company that, in the future, anything can happen or doesn't necessarily align with my mission or my goals, right? And
Mhm.
so that's kind of um, a softer talking point that I've had to kind of have with myself, and it is something that does deter me in general from doing brand deal work because I want to stay authentic to my mission and my followers.
Yeah. Also, you never wanna come across as, like, slimy and salesy, and
Absolutely,
that's yeah.
absolutely.
I'm curious, what is your research, topic or emphasis this year?
Okay. This is a topic I also like to talk about. So, I am interested in urologic oncology. So, a lot of my research is on bladder cancer. So, different kinds of bladder cancer. There's a main kind of bladder cancer called urothelial carcinoma, but then there's these variants that are less known and the treatments for them are not that great. And so, doing research on those variants is something that my research mentor this year is passionate about, and I am on that bandwagon and I love it. I've been able to work with and collaborate with a lot of people, but also I've been able to kind of think about my own projects and how I want that to look. However, at the same time, I am also doing some research on social media. So I am working with a prominent physician from the East Coast, as well as two other urology content creators who are also residents, to do a systematic review of the literature, essentially, basically going into these official research article websites like PubMed and Google Scholar and looking at what have people already looked at in the space of urology, social media, and scoring the quality of that information on social media. So that is something called a systematic review, a literature review, or a meta analysis, where you actually pool together all of these different research studies and look at and try to find larger patterns from pooling together all of these data. So that is something that I'm really excited to do. And I've already started on it this year. And lo and behold, poor quality information on YouTube and TikTok across a lot of fields, but particularly in urology, even including all the subspecialties. And I'm actually presenting that work in part of that work and part of my journey on social media. I'm actually presenting at Euro Advocacy. So, Euro Advocacy is a national conference that happens. It's like basically almost like a political conference where we advocate for urologists and policies that could affect our patients and urologists at at Capitol Hill. And it's happening from February 23rd to 25. And I am basically giving a talk at a plenary session for 40 minutes on social media. And this is in front of representatives, senators, but also private practice physicians from all over the country, as well as like chairs of different departments. And I'll be presenting part of this work, but mostly I'll be talking about sort of my journey for social media and how we can use it for patient advocacy, physician advocacy, combating misinformation, equity, and all of the benefits of having social media, but also what that means in terms of policies and interventions that the urology community as a whole can do to combat some of the negatives of social media in our
Yeah,
current healthcare climate.
congrats on that. I mean, you're like the perfect person to get up and share your story and your opinions and some of your research that you've done. That's a
Yeah.
great opportunity. If okay, so if there's a med student or a resident out
Mhm.
there that feels like they're having to shrink themselves to fit in,
Mm.
what advice would you give them?
Don't do it. Don't do it. Um, and there is, I think there's a time and place for everything, and that's what I say. And you don't necessarily have to shrink yourself, but you can choose which aspects of yourself you show to whom. And I think that is very different because once you um, gain trust and you gain the rapport with the people you are trying to fit in with, then you don't have to shrink yourself or hide yourself, right? Then that is the ultimate goal. And it's about, which hill are you willing to die on? Which part are you willing to give a little in order to get more in the
Mhm.
future? It's almost about like delayed gratification is what I say, right? I am pretty unhinged online and in person, but I am hinged with certain folks. And I think um, that has allowed me some currency to be unhinged in other ways and just to allow my personality to come out in different ways. But I also think like nowadays I see people appreciate my authenticity, and when I communicate that to the people who may not appreciate my authenticity, then they can't really say anything either, right? Like when I'm saying, look at all these people who appreciate that I am being my authentic, genuine self. And then they're like, oh, okay. So, because sometimes it's just like a little ignorance, like they don't know, right? They
Mhm.
don't know that it's okay to be different, right? Like you have to realize like the people that you're trying to fit into have been told something for a very, very long time. They've been told all these things that they have to be a certain way in order to be that. And, you have this opportunity to show them like that it doesn't have to be that way, right? Look, it doesn't really have to be that way.
Yeah, I
So
I think back to residency, like some of our cases, our free flap cases would be, 12, 14 hours long. You really get into some weird, quirky conversations with your
100%.
bosses, which is fun because you really get to know each other. But certainly, just like you were saying, there's like a time and a place for everything,
Hmm.
and you can show yourself to different people in different ways. There were certainly attendings and residents that I had more fun with, and
Hmm.
then there were other folks that you had to
Hmm.
be more straight laced or hinged with.
Yeah. Yeah.
Yeah,
Absolutely. And, you don't have to please everyone.
yeah,
That's also the thing. It's like you don't have to be liked necessarily by everyone and everything, right?
yeah.
Sometimes it's not worth it.
Well, I wanna thank you for being on the show today. Where can our audience find more of you?
I would always point them towards my Instagram or TikTok, which is the same handle. It's dancing underscore euro underscore doc. And so that is my Instagram handle, that is my TikTok handle, and I post very similar content on both of those platforms. I am on X, but I don't use X that much. I am Maheetha, MaheethaB on X, but X is still being used by a lot of professional societies, but I do see that they are moving more and more towards Instagram, and I'm really happy to see that. So that's where you can find me. And thank you so much, Lauren, for thinking of me and having me on here. It's such a great kind of full circle because I still remember our first live together when I first had my TikTok, and it was like literally only like 1,000 something followers. And you were so gracious and generous to like do a live with me, and you were just starting your practice at that time. You were in actively building it, and I got to see that journey, and it was so inspiring to see that. And so this is so nice that it's like such a full circle.
Well, cheers to another woman out there just being herself and doing her thing. I love it.
Thank you. Advice do you have for people who like starting your own practice is hard, right? What advice do you have for people, particularly women like me, who are now second? They're thinking a little bit more about a career in academia and seeing what your career could look like. What advice do you have for surgical women who want to start their own thing, whether it be a practice or social media?
I think first is to kinda know thyself,
Uh huh.
which I have an amazing coach, Dr. Mel Thacker, who's also part of the Hippocratic Collective, and she talks a lot about, like, which hard do you want?
Mm,
Which hard do you want? If you go into academics,
yeah.
there are certain things that are easier. You get
Yeah.
fed patients through a
Yeah.
pipeline of referrals, but there's a lot of restriction on your autonomy in
Yeah.
terms of, like, exactly the patient intake process and your
Yeah.
schedule and things like that. Whereas building your practice, it's the complete opposite. You have complete autonomy over everything, but you have to hustle in other ways to get people in the door and to get your name out there. And I have always been kind of a scrappy person. Like
Mm-hmm.
I just figure stuff out. Like I don't take no for an answer. And
Mm,
so um, every aspect of opening this business had unique challenges from when
yeah.
we purchased the land, like a piece of grass,
Yeah.
and I had to go to the city to get it rezoned
Mhm.
because it was initially zoned for retail.
Mm.
Some medical professionals will be like, I don't know how to do that. And I'm like, well, everything's on Google. Now everything's on AI. Like,
Yeah.
go ask the internet, how do I convince a city planner to let me rezone this piece of land? Like, you
Okay.
got to, everything in life is about sales. Like,
Yeah.
convincing the city why me bringing this practice here is a good idea.
Yeah.
Um, Certainly, like the HR component has been a big challenge.
Yeah.
Folks that are part of big practices and academic places, you don't have your feet on the ground in a sense of like hiring and firing everyone that makes the healthcare wheel spin.
Yeah.
And so that has been a real growth opportunity for
Right.
me. I kind of like as a chief resident, I was like, oh, like I can lead, I can make this work. It took me a while to realize that surgical residents are a different breed of human than
Mm.
like the average kind of population.
Yeah. Yeah.
For good and bad.
Yeah.
So having to kind of readjust my like brain and approach and the way I talked with people and um so there's always I feel like the crazy lady at the circus with the sticks and the plates that are spinning, you have to drop some plates and that's
Yeah.
okay.
Yeah.
For instance, this week in our building, the humidifier for my operating room was
Uh-huh.
like not, there was like leaking and blah, 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 blah. And it was so fucking annoying to deal with because I had to have the same company out 3 times
Uh-huh.
and I was here one night late with them. But I would rather that plate drop than a patient.
Yeah.
So everything in life is, comparison. And so I always tell myself when something's going wrong, I'm like, at least a patient's not having an issue.
Okay.
Um,
Yeah.
so I think first is knowing what's important to you, knowing which hard you want.
Yeah.
Um, I also think you don't have to figure everything out right off the bat. We have
Yeah.
this huge long life, this long career. And
Yeah.
so it's okay if you want to change your mind and pivot and do something different after five,
Yeah.
10 years.
Yeah. Okay. Yeah, I'm starting to like think about, what different careers could look like. Because, you know, when we're a resident, academic medicine is all we really know, right?
Hmm.
That's what we've all known for a long time, whether from pre-med to medical school to residency. And so, thinking that there are other ways that you could doctor and impact a lot of people that don't necessarily require you to be in academic medicine is like sometimes like a new novel thought for a lot of residents, and it's like the first time we're really even thinking about that. So it's really nice to see people kind of achieve that in their dreams.
And I will say facial plastics is unique in
Mhm.
that it's highly elective.
Yeah.
I went into the cosmetic aspect of it, and really my 4th year when I went on a bunch of interviews,
Uh-huh.
it was eye-opening because you're right, all
Yeah.
you see is academic medicine, but
Yeah.
then all 14 of my fellowship interviews were private practice, pretty much solo docs on their own that own their own business. And I purposefully
Ah,
applied to those types of programs
gotcha.
because that's kind of what I wanted in a
Yeah.
career. And so going on the interviews was helpful, just like proof of concept, like,
Mhm.
oh, this is like a viable way of providing care. All these people like run their own businesses. It can't be that hard, like that like little bit of delusion that I have deep
Yeah.
down inside me that I can do anything.
Yeah.
So the interview process was super helpful. It was hard to get time off to go on that many, but
Yeah.
I'm glad I went on that many. So I think like when you're planning a fellowship and
Yeah.
applying to different programs, it's really helpful to deep dive into those programs and make the most of the interview process because it gives you a different view of how many opportunities are out there.
Okay. I'll I'll do that. I'll keep that in mind. Thank you.
Yeah.
Thank you so much for always being an inspiration.
Today's episode is brought to you by the Hippocratic Collective. Check out our shows and content at hippocratic-collective.com.